If you're suffering from a severe toothache, you could need a root canal. And if just hearing that term makes you feel anxious, you're not alone. But our next guest says having a root canal can actually be a positive, comfortable experience. Welcome this morning, Dr. Sonia Chopra. She's a board-certified endodontist with Ballantyne Endodontics. Good morning to you, Dr. Chopra. Thank you for being here today.
Good morning. Thank you for having me here.
Our viewers probably don't know, this week is Root Canal Awareness Week, so you're going to alleviate everybody's fears about root canals. Let's start with this. I mentioned you're an endodontist. What exactly is that? What does that mean?
Well, an endodontist is a dentist that specializes in root canal therapy. We go to another 2 to 3 years of school after dental school in order to become a specialist, and I would say most endodontists do about 6, 8, and even on a busy day, maybe even 10 root canals a day.
Really?
Yeah, so I'm here for Root Canal Awareness Week to kind of let people know about root canals and that they are very comfortable, and also to let people know about endodontists, to let people know that we're out there. And our mission is really to help you save your natural teeth.
Okay, that's good to know. You really are passionate about this field because you had your own dental difficulties when you were a child. You want to tell everyone about that?
I did. I suffered from a severe toothache, and unfortunately at the time they told me that my only option was to get my tooth out. So they took out my tooth, and I still had the same pain. The pain was actually coming from a totally different tooth. So I got the root canal in the right tooth, and I can tell you from experience, it's a very comfortable procedure. But you can see just how that experience really had an impact on what I do today. And I'm very passionate about saving your natural teeth.
Okay, we like that too. All right, tell us what we should know about root canals. First off, what exactly is it? I think people may not necessarily know. And when does somebody need one?
Sure. So I'm going to use my diagram here to illustrate that. I have 3 different teeth here, and I've made them look a little bit different on purpose because teeth are all different. There are a lot of variables inside our teeth. And so everything with root canal therapy is bacterial, okay? So bacteria gets inside the tooth, and maybe it's from a crack, maybe there's some decay inside the tooth.
Ew.
And then with time, if you leave it long enough, the bacteria goes inside the tooth.
Ew.
And inside your roots, you have this root canal, okay? So there's the root canal, which is the area inside the tooth that houses the pulp tissue, and then we perform root canal therapy, okay? So again, if left long enough, the infection goes all the way up to the tooth, and you can even get some effects on the bone, and the bone starts to disappear.
And you will feel that. A person will feel that pain.
Not always.
Okay.
Sometimes this can be a very painful process. Sometimes people don't even know that this is going on in their mouth. So the root canal therapy is basically we want to get that bacteria out of the tooth. Okay, so we go inside the tooth. We clean all this up. I'm actually going to switch my color here. So we clean all this up. We go inside here because now the bacteria's gone into that canal space.
Yeah, get in there and get rid of that, Dr. Chopra. We don't want that in there.
And this is where root canal therapy can be a little bit technique sensitive. And so there's 2 cardinal rules that you have to follow in root canal therapy for it to be successful. You want to find all these canals, and you got to get to the end of every canal. All right, and so sometimes these canals can be a little bit hard to find, so we recommend doing root canal therapy with the dental operating microscope. And now we even have 3D technology that really helps us see the tooth in 3D and visualize the whole tooth and where those canals are. So with the root canal, we go inside here and we clean this tooth, and then we put a root filling in here. Okay, and so we seal up this tooth. Okay, we get the bacteria out. We're changing that environment, and that's the seal, and then the final seal comes when you get a crown on the tooth, and that provides the permanent seal.
Okay. You can save the tooth. Let me ask you this question. What is the reaction of your patients when you finish their root canal? What do they say to you?
That's my favorite part, because they get up and they say, oh my God, that was way better than I thought it was going to be. And you know, sometimes we even find them falling asleep on us. So we're really here to bust that myth that root canal therapy is a painful one, because it's really comfortable. With good anesthesia, it's really not a problem.
I can attest to that. I told Dr. Chopra I've had 2 root canals. They were just not a big deal. It was non-eventful. You've got a social media campaign going on right now. Can you tell us about it?
Yes, and I'm going to give you our little foam finger.
Oh, right on. Okay, thank you.
Our campaign is called Give Teeth a Chance.
Give teeth a chance, everybody. Come on.
We also brought you a shirt that says Love Your Teeth.
Oh, I love my teeth. I do actually love my teeth. I love them very much.
We believe that a healthy mouth equals a healthy life. And so we want to continue that awareness and let people know that there are alternative therapies to an extraction. And so if you are told that your tooth needs to come out, make sure you understand the why it needs to come out. And if you don't, ask those questions.
I think call Dr. Chopra. That's what I think. To learn more, call Ballantyne Endodontics. The number is 704 704-541-7017. Again, 704-541-7017. Or visit BallentineENDO.com, BallentineEndo.com. Dr. Sonia Chopra, thank you very much for being here today. Great job. Nicely done. Drawing on live TV. I'm impressed. All right, still to come.